Wonderful. Okay. So let's get started. My name is Dr. Bernhardt, and I am the faculty advisor for the degree in Kinesiology and Sports Studies with a concentration in human performance. And I hope you are all here to explore, I guess, your opportunities in this field. A few, I guess, rules, if you will, at the beginning here. Please mute your mic so we avoid any background noise and you can still all hear me fine. And you can ask questions using the chat feature at any time. I actually have it open here right next to my screen so I can see any of your questions and can respond right away. Also, I was told that the university bookstore is offering 20% off. So if you would like to use that, the promo code is LionsDen20. And with that, let's get right into my little presentation here. It shouldn't take too long, and I'll open up for questions right afterwards. So what do you want to do? Are you interested in a healthy lifestyle? Do you want to know how your body works or everybody's body works? Do you wonder how physical activity and nutrition affect your body? Do you want to give others the guidance and strength to lead a healthy lifestyle? Do you want to help others recover from illness or injury? Are you a hands-on person? Do you like to work with patients or clients one-on-one? And do you like to help people attain or regain the ability to walk and carry out daily life? If you answer yes to any of those questions, you are in the right spot. So what is human performance really? The degree in kinesiology, especially the concentration in human performance, is a field that has many, many avenues for you to go down. It's a field where there's lots of different opportunities, but especially if you continue on your education. So really the human performance concentration is more like a stepping stone degree. So while you can, of course, find jobs after getting your bachelor's degree, the real value with this degree comes when you further your education, either with a master's degree or with a doctorate degree. So what can you do with a bachelor's degree? You can do any like entry to mid-level jobs in the fitness industry. So for example, strength and conditioning, coaching, training of any people. So personal training, group fitness instruction, anything like that. Lots of places in corporate wellness are looking for people that have a degree in kinesiology and human performance. Exercise physiologists also have a bachelor's degree at least. With a master's degree, going on into the exercise science world, you can then do more of the mid to higher level positions in fitness and wellness, as well as in healthcare, and especially in cardiac rehab or pulmonary rehab. So exercise physiologists are really sought after in those places. And then, of course, doctorate degrees, not just PhDs, which PhDs are usually academics, so they're doing teaching and research in colleges and universities, but then also your physical therapists, your DPTs, and your occupational therapists, so your OTDs. And then, of course, also higher level administrative jobs in the health and fitness world. So your career options are plentiful. Anything you can think of in fitness, nutrition, wellness. Lots of different avenues in therapy and rehabilitation. And then also medical and nursing, and many, many more. So just to give you a quick overview, this is data I pulled from the Bureau of Labor Statistics. And this was data from 2018. So it's a little bit outdated, but it's still very relevant, really. So we have on the left here, in the left column, the job descriptions, and then what the median pay was in 2016, the number of jobs that were available in that field, what you can look forward to in the year 2026, what's the job outlook. And you can see here, all of these fields are growing. So any of those, the ones that have the 1 asterisk means that they're growing faster than the average job. Anything with 2 asterisks means growing much faster than the average. And as you can see, almost all of these jobs have either 1 or 2 asterisks. So the job outlook is very good in this field. And then on the very right side here, the last column shows you what degree is required to obtain any of those jobs. So a lot of these are requiring bachelor's degrees. Some are associate's degrees, so the 2-year colleges. And then we have a few of the master's and then the doctoral programs here. Post-secondary non-degree means so you have a bachelor's degree and then you go for a certification within that specific field. So this just gives you a quick overview of some of the jobs that are out there and really sought after, and what we really what we can look for in the next few years to come. So back to the kinesiology degree. Our department, the name is Health and Human Performance. The major is called Kinesiology and Sports Studies. The concentration is called Human Performance. Now, with this concentration, you also need to declare a minor. And a lot of times, if you want to look, or if you want to go into the higher level or higher education in terms of master's degree or doctoral degrees, one of the best minors is the interdisciplinary studies minor, because this minor is not limiting you to certain courses, but you can basically pick and choose the courses that would work for, you know, your prerequisites for example, the PT programs or OT programs or the grad school professional programs that are not currently already part of your major. One quick thing to notice, take anatomy and physiology as early as you can, so BSc 2401, because that is one of the main courses that is a prereq for many of our major courses. So if you take that early, then it won't keep you from taking our other major courses. So you'll be set in that. Also, keep in mind that you need a 2.5, I'm so sorry, that should be a 2.5 GPA for all upper level courses in HHP. And I will change that number, 2.5 GPA, sorry about that. So looking at all of the courses that you would need here in a overview, we have the major requirements here on the left top, major electives on the bottom, and then on the right side, the core curriculum requirements that you need for any major anyways, and then the minor requirements. And that would be up to you what minor you're choosing, which courses you're choosing for that minor. But looking here at the major requirements, you have all of your standard basic kinesiology courses, and then going into the higher level here, starting with the 300s, motor development, exercise instruction, nutrition, biomechanics, measurement and evaluation, exercise physiology. And then you have your science courses here, so anatomy and physiology 1 and 2, the first chemistry, the first physics, college algebra, and then 2 FRA courses, which are just your physical activity courses. And then you would pick any of the three major electives here, any three of the list down here. And that would be up to you what you think is most interesting to you or what might be helpful to you in your future career. For your core curriculum requirements, these are, as I said, for all of the majors required. Some of the things to note, anything that is in bold here is already part of your major. So these courses would count for your core curriculum requirement. So for example, here in this category here, 030 Life and Physical Sciences, there's a long list of courses that you can take. So I suggest to just take A and P because that's already part of your major. That's a course that you would need to take for your major. So might as well double dip and use it for the core curriculum as well. Another one to note here is nutrition, HHPH 331, which is part of the social and behavioral core curriculum. So that would count for that as well. Okay, so that's pretty much all I have for you. Contact information, this is me right here, Dr. Bernhardt. I'm the faculty advisor. My office is in the Nursing and Health Sciences building inside of the Human Performance Lab. So it's 165D. And here's my email if you have any questions. Ms. Wu, Ms. Anne-Marie Wu is actually also joining us in this Zoom. So I also included her in here. She is the advisor for our college, and she's in charge of the kinesiology majors as well, both the human performance concentration and the physical education, teacher education concentration. So there's a little bit of overlap between those two concentrations. So if you're not exactly sure what you want to do yet, I suggest to start with the basic courses that are common between the two concentrations. And then hopefully you decide sooner rather than later which path you want to go down to. Anne-Marie's office is in Education 204. And I will stop here and ask if you have any specific questions for me that I could answer. No questions? That's a great question. How would your first year look like if you have already taken most of the core classes? That is great. If you can transfer all of those core classes over and they fit in that core curriculum, then we would just start with your major courses, major and minor courses, and we would figure out which of your courses that you've taken actually transfer and then go from there. So if you would like to email me or Anne-Marie and we can figure that out, and yeah, we would go from there. you have any questions about the PT route or the OT route, or do you have any idea of what you want to do yet? Well, if there are no more questions, I guess we are done. For PT, observation hours are needed. Yes. How do I get started on it and how do I keep a record of it? So you would have to find a place on your own. So we cannot help you with that, but we can steer you in the right direction maybe, or give you some contact information to places where we've had students do their observation hours already. But you would basically call the place where you want to do your observation hours and just ask them, and they will keep a record of it, and you will keep a record of it as well. Yes, for PT, the sooner you can get some observation hours in, the better, and the more of a variety of places, the variety of settings you can do, the better as well. So I certainly encourage to do that as soon as possible and get your hours in. Yeah, how rigorous is the PT application process, and what would be some of your tips for the process? It is a very rigorous application process. The prereqs in terms of coursework are already pretty rigorous. So some of the courses that we require for the major are prereqs for PT programs, but there are certainly more that are required, which is why I suggested the interdisciplinary studies minor, where you can apply many of those prereq courses into the minor. So for example, the second chemistry, the second physics, you would need usually psychology courses, at least one, sometimes two. Statistics is preferred. Also medical terminology. And so those extra courses that are not part of the major, you could then apply into the minor and get those requirements done and completed that way. The PT application is very difficult. It's really hard to get into PT programs at the moment. It's actually harder to get into the PT program than it is into medical school. So that's why I also said to start early on your observation hours, to get as many hours in as you can in as many different settings as you can. And then of course, you would take your GRE as well, so that counts into it as well. There's a GPA requirement. The requirement usually states 3.5, but we have had students with a 3.9 that were not accepted in the first round. So it is a rigorous process, but we've had several students that were successful every year. So it is doable and can be done. And another option is, if you're not getting into the PT program of your choice right away, another option or plan B could be the PTA, so the physical therapy assistant programs. So for that one, you would, that program is usually around 2 years, and you would get similar clinical experience through that program. And it's much easier, of course, to get into that program. Taking just the required courses for your major would make you eligible to apply for any of the PTA programs. And that might be a very good route for somebody that is might not be so strong academically, but really wants that hands-on experience. So PTAs are really the ones that are hands-on with the clients, with the patients, whereas the PT, the doctorate, the DPT is doing more of the assessments of the patients and writing the plans and then doing most of the paperwork. So the PTA is usually the one that is involved with the client on a day-to-day basis. So there, but PTAs don't make as much money. So there's your drawback for that. But both very, very good jobs to have, and definitely the outlook for job growth is there. And then there's also the PTA to PT bridge program. So once you're in a PTA program and complete that PTA program, then you can apply for the doctorate, and you would not have to go through the full 3 years of DPT school. So there's another way to get your doctorate without having to apply directly to PT schools. Question is, how do I stand out among applicants who is also applying for the PT program? Well, that's a great question. It would be up to you, because everybody's doing the same coursework. The prereqs are exactly the same, no matter what school you attend. So what sets you apart is really your observation hours and what you've done in terms of volunteering, maybe, or your hands-on experience that you have within the field. Yeah, so that's what makes you stand out. And let me give you the official website if you have not looked at it yet. ptcis.org is the official website for everything related to PT and PTA programs. So it gives you all of the information and details and prereqs and list of programs with their application materials for all of the PT and PTA programs in the United States. So if you're interested in PT, anything related to PT, you need to be familiar with that website. And it gives you everything you would ever want to know. And that's also the place where you would apply for PT programs and PTA programs. So everything is in one spot. It's centralized. So it's PTCAS stands for Physical Therapy Centralized Application Services. What other questions do you have for me? Is anybody maybe interested in OT school? Occupational therapy? I get that quite a bit too. For occupational therapy, the official website is aota.org, in case you're interested in that as well. Okay, if there are no other questions right now, you have my email address. Feel free to email me or Anne-Marie, and we'll get you set up for the next few semesters until graduation. All right. Thanks for tuning in. And I hope to see you soon. Hopefully, actually face-to-face and not just virtually. All right. Thank you all.